I'm Dr. Robert Louche, a board-certified OBGYN physician with over 30 years of clinical practice. Today I'm going to talk about heartburn in pregnancy, or GERD, Gastro esophageal reflux disease is the technical term. And we'll see if we can't help you get through that and why does it happen more often in pregnancy. So pregnancy is definitely a challenge, and there are many changes in your health and your digestion. One of the things that some of the hormones do of pregnancy is it slows down gastric emptying. So when you eat some food, your stomach digests it, there's acids, there's mechanical digestion, the food moves down, and that process goes slower. Plus, as your baby grows, the room for your intestines starts to get crowded, and that pushes your intestines and your stomach up higher. Those two together make it more common for a little bit more acid buildup in your stomach and for that to wash back up your esophagus, the tube from your mouth to your stomach, and that can get irritated and cause some cramping and some discomfort and the symptoms of heartburn. So understanding why that happens in pregnancy might help you with some of the strategies to make it better. One of the first is try to modify how you eat, especially as you get further along. Eat smaller portions more often. Also, if you're really starting to have trouble with this, try to restrict the amount of food you eat before you go to bed. Try to stay away from food in the last 2 hours, because once you lay down, when you're laying flat in bed, that's how some of the acid kind of washes back up your esophagus and irritates you and causes some of that discomfort. It can be pretty uncomfortable, and it does progress during pregnancy. In fact, if you have that quite a bit, what you might do near the end is elevate the head of your bed. So you put a 2x4 under your bed, or you put some bricks under it so the whole angle of your bed is up by about 2 inches, and that can help some as well. You also might find near the end of your pregnancy in the last few weeks that getting in a recliner is more comfortable than your bed. From that perspective, but also just from laying flat, tossing and turning, getting uncomfortable, many pregnant women find that that's more comfortable. There are over-the-counter remedies that can help. There is Tums, Mylanta, the H2 blockers, which is cimetidine, Tagamet, famotidine, ranitidine. They're over the counter. See what's available there. You can take those during pregnancy. And then there are what's called proton pump inhibitors that really cut down on the acid, and that should be left later on, and that's like omeprazole, Prilosec OTC is what the brand of that is. Those medicines are pretty strong, and I certainly want you to be discussing this with your physician on their personal recommendations for you, especially adjusting things for your particular situation, but this will give you some general ideas on what's okay. If you're needing that highest level, though, I certainly encourage you to speak with your physician. There are special circumstances that you need to watch out for. For example, if you're a patient who's had gastric bypass surgery and you are pregnant, that definitely warrants further attention and discussion with your healthcare provider. I hope that you have found this general education of value so you can ask more specific questions when you see your physician or provider, and please leave comments if you'd like. Thank you.